This meeting is in observance of the Sunshine Law. The notice of this meeting is pursuant to the Open Public Meetings Act of NJSA 10:4-10, has complied with and shall be entered into the minutes of this meeting. We normally meet at 2:00 on the third Thursday of every month, every other month if possible. Any motions put forth in this meeting can only be voted on by members, and a quorum is required to vote on a motion. Just a little bit of housekeeping before we get into introductions. This meeting is going to be recorded just for Michael's sanity, so that way we can have accurate minutes. So again, good afternoon, everybody. My name is Robert LaForgia. I am the manager for Healthier Middlesex, the partnership between Robert Wood and St. Peter's, and the chair of the Human Services Advisory Council, as well as the Planning Council. And then I guess we'll just, Michael, if you want to take it away and call out folks, and then we can get going with the meeting minutes.
Sure. So I'm just going to go down the list for people to provide introductions. I have Honorai.
Yes. Hi. I have my camera. It's connected to my Bluetooth. I'm Anna from the Family Support Organization of Middlesex County. I'm the community outreach coordinator / youth coach coordinator as well.
Thank you. Kyle Anderson.
Good afternoon, everyone. My name is Kyle Anderson. I'm the Executive County Superintendent for Middlesex County Schools.
Thank you. Ashley Watson.
Good afternoon, everybody. Ashley Watson, Community Alignment Specialist at Central Jersey Family Health Consortia with Connecting New Jersey and Family Connects.
Awesome. Thank you. Beatrice.
Beatrice After with Community Affairs and Resource Center. I'm the Executive Director and CEO.
Thanks for joining us. Bridget.
Good afternoon, everybody. Bridget Kennedy. I'm a member of the HSAC. Oh, and the chair of the Legislation Committee.
Thank you, Bridget. Chan.
Chan Caldwell, member HSAC, past chair.
Thank you, Chan. Sylvia Costa.
Good afternoon, everybody. Sylvia Costa, County Services Specialist for the Middlesex ECPMP Middlesex and Union Area Office.
Thank you. David Blevins.
Good afternoon, everyone. Excuse me. Dave Blevins, the aide to Commissioner Ascona Barber.
Thank you. Eric.
Good afternoon, everyone. Eric Spear, retired correctional officer, current youth advocate, and HISAC member.
All right. Thank you. Ezra.
Hello, everybody. Ezra Helfand, Executive Director at Wellspring Center for Prevention and past chair of this great group. Thank you.
Thank you. Gloria.
Hi, everyone. Gloria F. Tansky, CEO with United Way of Central Jersey and an HSAC member.
Okay, thank you. Rick.
Hi, everybody. Rick Hager. I'm the Community Outreach Coordinator from the Department of Children and Families.
Thank you, Rick. Iris.
Hi, everybody. My name is Iris Gomez, and I'm the Program Coordinator of the Middlesex County Alliance here at United Way in Central Jersey.
Thank you, Iris. Jack?
Hi, can you hear me?
Yes, sir.
Oh, great, because I've been having a microphone. I'm a planner with Middlesex County in the Department of Transportation.
Thank you, Jack. Latanya?
Hi, everyone. Latanya Harry, staff attorney with Central Jersey Legal Services and a member of the HISAC.
Thank you. Leslie? Leslie, are you there? All right, we'll come back to her. Manny?
Here I am.
Oh,
I'm sorry.
Oh, there she is. Sorry, Manny. Go ahead.
Hi, Leslie Moore, South Brunswick Public Library. I'm a library social worker. I'm here with Olivia Boulos, who is a George Mason University MSW intern working with us this year.
Awesome. Thanks for joining us. Manny?
Yes, Manny Vasquez. I'm representing Visions and Pathways, and I'm the Independent Life Skills Supervisor for the Prosperity Program.
Okay, thank you, Manny. Maria?
I don't know if it's me, but I'm Maria Betanzos. I'm from Women Aware, and nice to see everyone.
Thank you for joining us. Melissa?
Good afternoon, Melissa Lewis, the County Office of Human Services.
All right, thank you. Mimi?
Mimi, okay, I didn't know if I was open. Mimi Ganger, a member of the HSAC for 100 years.
Okay, well, thank you for still being here. Adam?
Good afternoon, Adam Neary, New Jersey Department of Human Services, proud fan of the New York Mets today. I know Ezra would like that.
Reina?
Good afternoon, Reina Garcia with Zuffa Health. I'm the Senior Outreach Representative.
All right. Rosella?
Good afternoon, everybody. Rosela Roman from Mobile Family Success Center of Middlesex County.
Thanks for joining us. Ronnie?
Hi, everyone. Ronnie Salkin, JFS Executive Director, Jewish Family Services in Middlesex County.
Thank you. Wanda?
Good afternoon. I'm Wanda Dillon. I'm the Director for Division of Children's Services with the Department of Human Services.
Thanks for being here, Wanda. I did see someone join. Jennifer, did you want to introduce yourself, please?
Good afternoon, Jennifer Pena, New Brunswick Public Schools, Community Parent Involvement Specialist, Early Childhood Education.
All right, thanks for joining us. Was there anyone else that I missed?
Self.
Okay.
Okay.
In that case, I think, Robert, we can move on.
All right. I hope everybody had a chance to go over the minutes that Michael was able to send out to us. I just need to, can I get a show of hands or a motion to approve the minutes from our last meeting? Thank you. Bridget, can I get a second?
No, wait a minute,
Oh.
but I have I think there has to be a change in the minutes under, wait a minute, under Roman numeral 5F. It looks like it to be a report from the Board of Social Services, but it appeared to be more from the Office on Aging.
Okay.
So I just think that needs to, but I will move the minutes with that change.
Okay, I'll take a look at it and see about making that change.
All right. Can I get a second to approve of the minutes with the proposed motion? Ezra and Mimi, thank you. All in favor? All right.
Any abstentions?
Nope.
Okay.
Okay.
Awesome. So there's some new faces here today, so that I haven't seen in a while. So thank you all for being able to make it today. We got a lot of good stuff coming down today. But I guess I want to kick it off first in the agenda with the Middlesex County ride presentation. I think I don't know if
Yes, so I apologize. I had Jessica down as providing the presentation, but the presenter is going to be Jack.
Fantastic.
Hi, everybody.
Hey.
I can, I need to just share my screen if that's okay with you. Let me get that set up. Hold on. I'm assuming you can see it.
Yep.
Okay, so I'm Jack Molinar. I'm the supervising transportation planner at the county, and I oversee this new program we started called Ride on Demand in New Brunswick. I'm just going to go over it pretty quickly, and I'll let you ask me questions then. Is that okay with you all? I guess so. So I'm going to continue on because I know you have a lot in your agenda, and there's a lot of you here. So basically, this was the vision of the county to provide a new form of transportation, to use some technology and use some of the things that are going on with Uber and Lyft. And that was try to do a little bit better than what was in the past a fixed route system that had fixed stops in New Brunswick. So this is just a real quick of what we have. It's what's called micro transit, and I'll get into that a little bit. We have 5 minivans. We do have wheelchair accessible ones. Users request a ride through a mobile app, and they get picked up by a driver. The service is different from Uber and Lyft. Uber and Lyft, they pick you up exactly where you are and brings you exactly where you want to go. This is a public transit, so it's a corner-to-corner service. You can see our hours. We do run 7 days a week. We have less hours on Saturday and Sunday. And
Jack,
we
I'm sorry,
launch.
but this presentation isn't moving forward.
What slide do you see?
The very first one.
It's just the
It says
first
Ride
slide.
on Demand.
Huh. All right. Don't know why. Let me try it again. Sorry about that.
I think when you put it into presentation mode, it sort of creates a different page. So that's the one that you would want to share is, I guess, putting it into presentation mode and then sharing that screen, unless you want to keep it in.
I could keep it. Do you see it now?
Yes.
I'll just keep it here, and you can see when I change.
Yeah.
Okay. You know what? Just for grins and giggles, let's keep it here.
Okay, thank you.
Thank you for letting me know. I appreciate that. Okay, so again, so this is the basic program. Like I was saying, you get picked up corner to corner. It is an app on your phone. We started in February. We did a couple of weeks as a free service. And then we started, it's a $3, it costs you $3 for every trip that you take. And this is right now all within the city of New Brunswick. Here's a little bit more of what the app looks. It's basically, if you ever used any Uber or Lyft app or other apps on your, it's basic, it feels the same way. This is the service we're using a third-party vendor called, the name of the company is Via, and they run this. If you've ever been to Jersey City, they run there. They run services like this, not just in America, but internationally. But that's that. So this is what you might have, if you've been to New Brunswick, this is what the vans look like. You can see we've had over 20,000 rides. We're 10 minutes to ride. We're getting a lot of accounts, and it's going really well so far. You can see what percentage we use. 51% are using it to get to work. A lot of people are using it just to get to downtown. I have a map further on in the presentation, and you'll see exactly the origin and destinations. So a lot of people are using it to get to the train. People are using it to go shopping, to the Aldi, which is on the other side of New Brunswick, which has always been hard to get to. So that's something that we wanted to make sure that people had other shopping options than just downtown and small convenience stores. Surprisingly, we had a lot of trips from kids going to New Brunswick High School, because the new high school is on the other side from where most of the people live. And a lot of students are using this to go to school, which was a little bit of a surprise, but it's not overwhelming our system. So it's Rutgers, some students from Rutgers are using it as well, but not overwhelming our system. They did a survey, our company, and these are some of the cool quotes we got from that. And we find that people are liking it because if they don't have a car, they were using Uber or Lyft, which is a lot more expensive. If you're using this for the round trip to anywhere you're going, it's $6 compared to what an Uber or Lyft would be. So we do hear from even outside of the survey, people that are now using this to get to work. and saving a lot of money. As you can see, we are serving a community that don't have access. A lot of them don't have access to a car. 60% have low income, and they're really happy with the service and be very disappointed if it didn't keep going. So this is a little thing of just showing you what our week to week, what kind of trips we've been getting per week. And here's the land use destination broken down from March through September. So over 21,000 rides. As you can see, I'm calling the land use designation low density, either 1 or 2 family. Medium density is more like garden apartments, and high density is 3 or 4 stories high, just to give you an understanding what that is. Entertainment is the theater, healthcare is the hospital. Everything else, I think, is other than border. There are some people that are on the border of New Brunswick that are getting picked up and dropped off right there. So we threw some people into right on the border where it wasn't obvious where they were getting the ride from. A lot of the government ones do get to go to the Board of Social Services, go to the Social Security office. So we're seeing that also coming to downtown government offices, the court. So we're seeing a good diversity of trips. Here is what I was telling you what you were going to see. The origin and destination heat map. As you can see, it is how bright it is and just really in the downtown, the train. You get New Brunswick High School is here. You have apartments where you have more garden apartments are here and here, way out. So even people on the other side of Route 1 are using the service. And this is St. Peter's over here. And here's the high rise in Buccaloo Park over here. So you can really start to see where people live. And as you can see, it's only New Brunswick. So that's why you have that really bright line here where there's nothing on this side and the trips are all here. The only part that we actually serve outside of New Brunswick that was part of this initial zone is the towers next to the turnpike that has a parking facility there, in East Brunswick. So this is just a breakdown of kind of what it is. It does serve. It is accessible. We do serve. We've served over 400 trips with wheelchair so far. Another common thing that people ask about these apps is, can you use a phone? The answer is yes. As you can see, 4.2% were through what's called the agent, which means they're calling for a ride. Many times you share a ride with someone else because if it's on the way, they might pick up someone else. So a little less than half have been shared with someone else. Close to 50,000 miles of trips have provided. We've probably collected about 70,000 in revenue, which is about $337 per day. So that's where we are with that. The route that the county used to run prior to COVID was called the M5. It was along the Jersey Avenue corridor, and it was only really running about once every hour. It was fixed route. It was hard to serve, and instead of reinstituting a service that wasn't greatly used is why the county went and tried to do this kind of service that's a lot more flexible for people using it than trying to get to a fixed route with stops that barely have a sign at it. Some of the changes we're looking at is to do a little bit more marking. The other aspect that we're looking to change is to right now where the vehicles are located at the before and end of the day and change in shifts is down in North Brunswick at our Public Works area garage. And what's called in transit is called deadheading, is the time you have to spend going to and from it. And if you have a lot of distance, as you can see, it hurts the actual service and what we can do. So we're looking to change where these vehicles are parked into New Brunswick at the Border Social Services lot, which is along off of Howe Avenue there. And we're also looking to expand the system outside of New Brunswick down to Route 1 to include this area of North Brunswick, just support because the population there has similar traits of the population just north of it in New Brunswick. It also has a lot more shopping opportunities that we think is really going to bring in a lot more riders and a lot more flexibility for the residents in this area. And that's about it. And I'll stop sharing.
What if I lived in North Brunswick? This doesn't work for North Brunswick?
No, right now, we started this in February, just in New Brunswick as a pilot and just to see how it would work. And that's how we're looking at it now. We're following the data. And that's why we have a proposed expansion down to Route 1, which is the northern part of North Brunswick.
Isn't there transportation for people who don't live in New Brunswick?
Well, the county still provides the ride reservation that still exists. That's never going to go away. This is instead of the fixed routes.
Okay. I get it.
Ashley, I see you have your hand up.
Yes. So to be clear, the ride reservation, because I live in Parlin, which is Sayreville, I see them come through my complex all the time. So that's ride reservation.
Correct. That's not changed. This has nothing to do with that right now.
Gotcha. So this is just the routes. Okay. And you guys do plan on expanding. That's great. Now, we work with low-income families, of course, some of them undocumented, and sometimes their phone service may get cut off for a week or two, right? What do we do in that instance? Is there an alternative to?
Yeah, that's the only way you can do it is either through the app or calling in.
Okay. So you can call in. Okay.
Yeah. That was, oh, absolutely. They can always, that was the agent aspect of it. Yeah, we make sure, I mean, we're pretty happy that it wasn't a high percentage of that. So it should, I mean, 95% are using the app.
Great. Okay, great. Thank you so much. I appreciate it.
You're welcome.
Gloria?
Thank you for the information. It's very helpful. Do you have any information that you can share on the gender and the ethnicity and race of the riders?
When they sign up, because we're using a third-party vendor, and some of that statistics we got was they did a rider survey, and they got a little bit of that, but not that much. And it's more of what we follow with that. We see kind of where their origins and destinations are, and we can go back and we can drill down through census data to see what populations and what housing area that we're serving. And then you start to know what you're serving. And that was why we kind of knew that we were serving the lower income. And if you look, New Jersey DOT and Transit is starting to use something called ALICE. What's the acronym stand for again?
Asset limited income.
Constrained employed. Yes. So by using that data, which shows New Brunswick was really high up on something that would do well with this. And I find now looking at that data is that if you look at a community, if you look at this, that is using in the travel patterns in the census data that is using taxi cabs or ride shares, those are usually communities that are not served well by transit, don't own a car. Another community we see in Middlesex County that is similar to New Brunswick is Perth Amboy is very similar in neighborhoods just like that. And that's the neighborhoods this is really helping out with because it's such a money saver compared to a taxi cab or an Uber
I have
or
one
Lyft.
other question. What are the plans for the $70,000 ride revenue that you've collected so far?
It just goes into, it's still public transit, so it is not a money-making operation, just like none of our routes are. It costs about, it costs north of $20 per trip, and we're bringing in 3. So, you know, that's pretty standard in public transit. So it defers some of the cost, but nowhere near.
Thank you.
Jack,
In
thank
the
you so much
survey,
for.
do they
Go
also
ahead.
ask for age?
I didn't
Sorry.
hear that.
I was inquiring if the survey also asked for the age, the writer's age.
I don't believe it did. I think it was in groups, but I didn't get all the detailed surveys from VIA yet. That was just some of the highlights that they gave me. We do have, the good thing is I do get the addresses of where people are going. I don't know who they are, but I do see, that's how I'm able to determine like land use. And I could see people going to the New Brunswick Senior Center. I can see people going to Elijah's Kitchen in New Brunswick. So I start to see where people are going, like the Social Security office. I'll start seeing those kind of trips. And that kind of gives me an idea of who's using it, but not to the detail of demographics that you're looking for.
Jack, thank you so much for all that information. It's a lot of it was really helpful. I have a couple of questions. I just want to know, I know you have the destination percentage. Do you have the origin percentage as well? Like the flip end of that? I know you have it on the heat map, but I'm just wondering if you have the origin percentage.
Well, the good thing is because I'm only the destinations, it gets the trip on the reverse back. So it's basically the same thing. That's why I'm just keeping it that way.
Because I thought I heard back in the transportation summit that was held, that most of the trips at that time were for healthcare.
No, we were looking to see, you can see the same percentage. Those percentages have stayed pretty much. The only thing that became flat in the summer was Rutgers and high school.
Okay. Okay, sorry about that. And just to confirm, so if a family of 3 is trying to get a ride, just to confirm, it's $3 per person, correct?
Correct.
Not per family.
Right. Yeah, that's how it's different from Uber, Lyft, or taxi cab. It's like I said, you have to think of it as public transit. Each passenger pays their fare.
And the vans are like technically ride share. So if 2 folks from the same block order around the same time, most likely that van will pick up both families or individuals.
Correct. Yep.
And then and this is just a concern that was brought to my attention from users of the app. And it's more or less the when a user is getting picked up, say at a food pantry or something along those lines, usually they're carrying bags of groceries with them. And when you're ride sharing with other folks, that could be kind of an issue trying to get in, trying to get out, especially when you have little kids with you, which we're seeing in a couple of our pantries. Just something we've ran into. Could there be any addition to the application in the future where an individual could say like have personal items, just to let the driver know and to let, just in case that there's not going to be room, like I have 3 kids and a bag, and bags of groceries or luggage or something along those lines?
That's a very good point. And that's something I'm going to ask our vendor. Absolutely. Thank you for bringing that up. That's a good point to know that's going on.
Yeah, and it's just, and it's discouragement too for folks who are trying to use the app, and then they have to get in there with 2 other strangers, and they're bringing kids in, and they got their groceries and stuff like that. So, but thank you. I just wanted to bring that up to your attention.
Thank you.
How do I get the app?
You go to your either Apple or Play Store and you download the Middlesex County Ride app.
And Chen, if you do type it, I don't know if you have a Samsung or an iPhone, but if you type it into the App Store, it pops right up. Actually, it does come up really quick. Bridget.
Sorry to interrupt. Jack, do you mind putting the information in the chat?
Yeah, I will. Once I'm done answering your
Perfect.
questions, I'll put it into the chat of how to get to it.
Yeah, well, obviously for years, transportation has been a big issue in Middlesex County. And this is really, really good to have it, but we've got 25 municipalities, and right now it's basically only in one of them. What's the timeline for maybe expanding it to more of the municipalities?
Well, the good news is I can't answer that since I'm not the one going to make that decision. So I could tell you that the M1 and the M7 are still operating. Those are fixed routes. New Jersey Transit still has their routes, but I know the planning office here at the county is always working with New Jersey Transit trying to find ways to do this. But this type of what's called micro transit is something that is being used like this in areas that the density is not real high, but high enough that we can do this kind, whereas the current like typical fixed route system wasn't working with, especially when it's only once an hour a bus. So that's why this is a way to try to use the public dollars in a way that serves more people and trying to do it in a way that's strategic and not over expand. And so they're doing it very carefully.
I have just one other, is the, and it was a Middlesex County transportation route that used to run out 130 and go down around Jamesburg where a lot of the warehouses are. Is that still operating?
No, that one is not. Right now, Mercer County is running a shuttle service from the south up into the parts of southern Middlesex County to the warehouses. The warehouse is another one that's very hard to serve because there's nothing walkable down there. There's no sidewalks, there's no bus stops. It's pretty unfriendly to someone who isn't driving a car or a truck.
Thank you.
You're welcome.
Awesome. Awesome. Any other questions? Gloria? You're on mute.
I just wanted to share with everyone, and Jack also, that we received a very small pilot grant from United Way Worldwide. It's called Ride United Unlimited Transportation. And so we have through the end of June, funding for 380 one-way rides, exclusive for people who are participating in our 5 major programs. So again, it's 380 rides divided by 5 programs. So that's 76 one-way rides or 38 round-trip rides. But we're happy to have received the funding because transportation is a barrier for so many residents of Middlesex County, particularly those that are really living on the edge, for whom Alice would be an aspiration.
Okay, are there any other questions?
Quick one, just Gloria. So where are those? I mean, would you just be like calling up Middlesex County to?
No. It's with Lyft, and there are very defined reasons for the ride.
Okay.
Which you can imagine. Employment,
Yeah.
appointments, things like that.
Okay.
I guess
Sorry.
I should have specified. Are there any questions for the presenter?
Jennifer.
Good afternoon, everyone. If you hear noise, I am home and I have 2 small children, but very quickly, I've used Ride a few times myself, only because where I work on Van Dyke Street in New Brunswick, our preschool, we have like no parking. So you have to get there half an hour early to get a spot. And if you lose your spot, that's it. So I have to travel to 12 different preschools throughout New Brunswick. And when this came out, immediately I signed up and I use it. I feel like $3 is reasonable. And I use it to travel throughout New Brunswick because I don't want to lose my parking spot. And I've had a pretty good experience, and we refer it to our parents. So some of my coworkers are like, oh, you don't mind riding with other people, but I'm from New York. I didn't own a car till I moved to New Jersey at 34. So I'm used to being on a subway with a lot of people. So I was like, no, not at all. I was actually pretty comfortable. So I have a great experience and I use it myself.
Awesome.
Thank you. Nice to hear.
Awesome. All right.
All right.
Oh, and you're muted.
Sorry, I transferred my phone to my computer. So I have a question. I know this the ride is strictly for New Brunswick residents or close proximities. But I do a presentation for a youth court involved And I know that's one of the challenges for youth are court involved. They're trying to get to their court hearings or meeting their probation officer, but sometimes the scheduling, it's kind of challenging, especially if the youth, they have to find a way, right? Have you guys thought about programs like this to be included for the RIDE program? Targeting specific programs that will benefit youth in need and that have no transportation or no type, or they're unable to get their license.
I know it's something that the county, when they started this, as they're calling it a pilot to see how it works and how best it could work. And I know that we want to hear about other. That's why I'm glad I'm able to talk to all of you today to hear, and you could hear more of what this is, so we can hear more about what your needs are, and you can send it to me, and I'll put my email in the chat too, and tell me more about your program, or we could set up a time I can hear more about what the trip demands are. I'm a transportation planner, so I always like to okay, where are they going? What's the origin of destination? What's the time of day? What's the volumes? And then I could start coming up with solutions.
Yeah, even for ourselves, we have a youth program, and we have a lot of kids from New Brunswick. And sometimes they do tend to share, or if they get acquaintance with another caregiver, long as it's not within our proximities because of liability purposes, they do share rides. But an Uber just for teenagers is
It's
almost about
expensive.
$40.
Right.
And imagine that weekly. That's a lot, and that's some of the reasons why our youth don't come to our program, because of transportation. I try sharing the right information, but when they reached out, they were like, "Oh, it's out of New Brunswick." So unfortunately, they couldn't come. But that's why I kind of think about other programs for youth.
Definitely reach out to me. I'll put my email in the chat, and we can talk offline.
Okay. Last chance for questions for the presenter. Okay. Well, thank you, Jack. I appreciate you coming and talking to us about the program. You're welcome to hang out. I'm leaving that up to you. You may have other things you need to take care of, so no pressure. But these are open public meetings, so you're more than welcome to stay.
Thank you very much for having me. I really appreciate the opportunity to tell you all about this. Thank you.
Thank you.
All right, Robert, back to you.
All right, let's go into some of the reports from our state departments. We'll kick it off with Mr. Neary and Department of Human Services.
Thank you, Robert. I sent over a copy of my report, and I know Michael has or will be sending it out. It's one of the top line announcements we want to make is last week as part of the opiate settlement fund. The state has announced that we released another $25 million for additional programs. It was from a recommendation from our public council members. The highlights of them is there's a little bit more than a $20 million investment to expand and create free legal services for individuals with mental health and substance use disorders. And also another $5 million to our colleagues at the Department of Children and Families South Jersey Youth Substance Initiative, which will expand that program. And then an additional $500,000 just to what we call our emergency funds to help with xylene strips and different hygiene kits and wound care supplies and such. All that information, as well as we reopened our public portal. So if you have communities that would like to submit some information about how we could do a better job, especially for the Black and brown communities, as well as older communities, please take a look at that portal. The deadline to submit some of your thoughts are October 31st. I'll put it in the chat room, the website, and you can follow the link to the portal. Also, one last thing. I recognized, I saw that the county Opiate Remediation Council has invested some money in New Brunswick and in Woodbridge for the vending machines. It has various different needs for the community, and we just took note of that, and just thought interesting way of using money. Otherwise, I just want to thank you guys for being here. Again, Michael has the written report. There's a few other items in there. Feel free to reach out to me for any questions.
All right. Thank you so much, Adam. Mr. Hagar with the Department of Children and Families.
Yes, thank you, Robert. I believe everybody in the group here is very aware of the organization secondfloor.org, the youth call-in and text line. A couple months ago, they launched a new service. It's an app for youth to download on their phones, and the app will get them immediately to intervention helps and to a counselor. So that's a very powerful tool that they've added. I'm going to send all these announcements to Michael, ask him to kindly distribute to the group too. There's various links in my little write-up here. Our department, DCF, also partnered with the ACNJ, Advocates for Children New Jersey, in our summer forum update. And there's an archived webinar recording, and you would view that and see our new initiatives and the status of our department and the things that are going on. There's a lot happening, a lot of good proactive work. And on this topic of good proactive prevention work, our Division of Family and Community Partnerships, FCP. FCP is currently endeavoring to do roadshows, virtual roadshows. They've already presented to some of the county HASAC groups. And if you've not heard from them yet, I'm going to include that in the email. The deputy director is Wendy Yalowitz, and her name and email is in the contact information. So I would recommend that to you. You probably heard or read my message earlier in the summer about the, on behalf of the Office of the Food Security Advocate, this summer EBT, electronic benefit transfer cards for eligible kids for free and reduced meals. That went out, of course, over the summer. However, that's still active because the rate setting is going to be determined for next summer during the current year. So to that point, there's a toolkit that is at the link that I'm showing in my email here. So that is, I'll ask anyone dealing with kids, school kids, families, etc., to distribute that. And finally, our department and me, we will be exhibiting at a number of conventions this fall, as we always do. Among them, I want to highlight one in particular at the NJEA, the Teachers Convention. This year, there's going to be a very special youth mental health pavilion, in which 10 provider agencies will be together in this pavilion to share their resources and to make presentations on this topic of youth mental health. So anyone that's going to or knows anyone going to the NJEA convention, I would recommend the Youth Mental Health Pavilion to your attention. Okay, so those are my announcements.
Fantastic. Thank you so much.
Okay.
Any questions? All righty. We will go to Ms. Costa with DCP&P.
Hi, everyone. I pulled some statistics for our caseloads. Give me just 1 second. I have them on my screen. I hope. Okay, so I pulled our statewide statistics and our counties so that you can cross-reference and have an idea of caseloads in the state versus our local area. But of course, now all I see is our local area, so I don't know what I've done. Give me just 1 more minute, I'm sorry. Here we go, statewide. Okay, so statewide, and it's broken down into investigations, in-home clients, and placement clients. So again, I'm giving you first our statewide statistics. So as of October 8th, investigation client, there were 18,604. clients under investigation statewide, and that represents about 62% of the total number of families, and that's very typical. Usually there's a much larger amount of cases under investigation than there are open for services. So investigation would be the families that are called to the hotline that are currently, there's about 60 days that the staff is given to complete an investigation, to make contact with the family, complete all interviews, gather information, and then gather collateral information as well. So that's contacting local police departments, pediatricians, schools, and basically gather information and complete an overall assessment. And then it's determined whether the family will need services or whether we're closing at that intake level. So there's 18,604 investigations statewide. For in-home clients, so those are clients that actually are receiving services. So the investigation is complete and it was determined that the client needs services. So that's 7,979 statewide. And then placement, there are 3,055 children in placement statewide. Then for our local, so locally, as of 10/08, investigation clients, 1,378. So that's for Middlesex County as a whole. I didn't break it down into the local offices. I'm just giving you a number as a whole for all 3 local offices. So again, 1,378. For in-home clients, and again, those are the clients that are receiving services, open for services, the investigation is complete, those cases were transferred, and this is number of children. So it's 756 children receiving services. And then placement, there are 139 children in placement currently in Middlesex County. I'm open to any questions you may have regarding that data. Okay. If you want to see any other type of data, I can pull it for our next meeting. That is fine. I only have access to the last year. So I know you guys have asked prior to compare to prior years, but I only have access to about 12 months worth. But I can pull gender, I can pull other demographical information if you'd like to see that. Let me know.
I think
Hi,
we have a question from Bridget first. I'm sorry. We'll go
It's
Bridget
okay.
and then Wanda, then Gloria.
Sylvia, so in-home, it looks like locally we have like 10% of all of the in-home services, but you said that's the number of.
No, it's about 29%. Let me look at it again. And I can send this. I can send this to Michael, the screenshots, and you can disperse it. But it's about, so for in-home, so investigation represents about 60% of the numbers this is for local only. And then for in-home, it's about 33%, 756. So it's about 33%. And then placement, we have 139, which is about 6%. Does that make sense? I'll send it out to Michael and then you can share it.
Okay, thanks.
Sure.
Wanda.
Yes. So Sylvia, I'm not sure if you know the answer to this, but in terms of the young people that are receiving in-home services, those are 756 individual children.
Yes.
But I'm just wondering if we have a sense of how many families that is.
Yes,
Okay.
I can pull the information that way as well.
Okay. And for our purposes in children's services, as we plan going forward, is it possible to get ages because we're seeing such an increase?
Yes, I can
under
pull
a certain age. Okay.
I sure can. I will send that to you individually, or does Michael want that as well? I'll pull that information and I'll send it.
Okay, sounds good.
Sure.
Thank
I
you.
think you can just send that to Wanda.
Yeah, okay.
Okay, so I'll
So
talk to you,
ages
Sylvia.
and families, sure.
Yeah, as we're in the middle of our planning process now, so that'll help us gather some good information because we're
Sure,
looking
and
at
Wanda, you can
some.
reach out to me anytime if you need information,
Okay,
any of that information, and I'll share
okay,
it with you.
thank you.
You're welcome.
Gloria.
Sylvia, for the 1,378 for the 756 children and the 139 in placement,
Yes.
can you share the communities in which the children are originally resided? Right. So if they're in
No, so I'm not able to break it down by community, but I can break it. What I can do is break it down by local office, and then each
Okay.
local office represents certain towns. So I
Okay.
can break it down by local office and then let you know which towns those local offices serve. So it gives you a little bit of an idea, but I cannot tell you how many per town, if that makes sense.
Sure.
At least I cannot. I mean, the state can. They have the capability to be able to pull that, but I don't have access to it.
Okay. And I'd also like to receive the information about the ages of the children.
Okay.
You're going to
Sure.
provide to Wanda.
Sure.
Thank you.
You're welcome.
All right, awesome. Let's move into the reports from our county divisions, agencies, and offices. I'll start with if there's anybody from the Office of Public and Government Affairs here today.
I don't believe there is.
Okay, we will move down to addictions and mental health planning.
So Lori had sent a written report, which I did send out to everybody. But one thing that she wanted me to highlight was that tomorrow is Wear Green in honor of World Mental Health Day. So if you get the chance, definitely try to wear green tomorrow.
Thank you, Michael. Wanda, anything from Division of Children's Services?
Yes, so I sent a report, but I'll just highlight two things. I just mentioned when we were talking to Sylvia that we're in the middle of our annual planning process. So Michael will receive a link from us and we will ask everybody from the HASAC if they could participate in taking that survey for us. It gives us really vital information as we plan for next year. Also, we are really making an effort to engage young people and family members on our various committees. If you work with young people or family, please let us know if they would be interested. We can, if they're willing to let you share their names, then Lakeisha Carter or I will contact them and talk to them about any volunteer opportunities to be on committees. In the past, we did have some young people on the committees and we did work with their schools around various credits to be on the committee. So it's a great leadership opportunity. We really want the youth voice and the parent voice because the survey really, we need to know what they feel the gaps in services are, what's working, what's not working so well that needs to be improved. So Michael has my information if anybody needs it. So you reach out to Michael and he will give you my contact information. We'll be glad to talk to you.
So thank you. I
And
don't
that's-
see. I don't see Lila here. Okay, we'll move down to Division of Housing and Community Development.
So Melissa is at a conference today, but she did send a written report, which I sent out to everybody. Again, with regards to these written reports, if anybody has any questions, feel free to send them to me. I will reach out to the offices and get an answer for you if there is one available.
Let's see. Board of Social Services. Is there anybody here today?
Stacy is normally either here or sends a written report, but she has not sent me a written report, and I don't see her in the chat. So I'll
Yeah,
try
me
to
either.
reach out to
Okay.
her later today and see if she has anything for us that I can send out with the follow-up email.
All right. Thank you, Michael. Mr. Dowd.
Okay, good afternoon, everyone. So I'm happy to report we had our pancreatic cancer walk and fun run last Saturday, and we raised funds for pancreatic cancer research over $27,000. So thank you to all that participated. And they also had the softball tournament. They had 7 teams play at Warren Park on the same day as well. So it was a very beautiful day, and it was a great event. I sent Michael. What's that?
It was also for cancer research, the game.
Yes. Pancreatic cancer for Cancer Institute of New Jersey. I sent Michael one of our chronic disease self-management programs that's going on in the Edison Library. We did do week 1, but people can still register up to week 2. We have 8 people, and we would look for some additional members. If anyone in the community is interested, we can get that flyer out to the group. Right. And our department has received additional COVID-19 test kits. We are in the middle of distributing those through your local Office of Emergency Management through all 25 towns. And then, we have some for our, ongoing community events. Thank you.
All right. Awesome. Thanks, John. I don't see Kevin here, so we'll go down to Mr. Anderson with the Superintendent of Schools report.
Good afternoon, everyone. At this moment, we're preparing for our attendance at New Jersey school boards toward the end of October. Also reviewing applications with Edison School District on preschool expansion, and we've been doing a charter renewal, observation and renewal, potential renewal for Academy for Urban Leadership in Perth Amboy. And we've got the business summit coming up on Thursday, and also have a DOE conference with all superintendents also on Thursday. So I'll be split between New Brunswick and Trenton tomorrow. Okay. And one other thing, preparing for my roundtable next Friday, and working with the County Prosecutor's Office on the New Jersey threat assessment team. And lastly, working with Middlesex County Office of Emergency Management on the reunification process and training for all school districts.
Okay, thank you so much.
Thank you. Yes.
What is stress assessment? What is that?
Threat assessment is where several different agencies on the federal, state, and county level work together to identify areas of threat against any of our schools. We try to use intelligence that would be shared and have some type of a streamline of information. So we are being asked by the state prosecutor to coordinate with federal agencies, the state agencies, and the county agencies to put together these teams. And we go through a 8-hour training, and but I will follow the direction of those law enforcement agencies. But it is a coordination of several different agencies.
Thank you.
Okay, well,
Right, thank you. All right, next, that concludes our reports from the county divisions. We'll go to upcoming events and provider updates. I have a note here for Women Aware. So if they want to go first, and then anybody else.
Thank
all,
you.
Jack.
Thank you for giving me the space. This is Maria Betanzos with Women Aware, and I am just going to share in the chat the information about our upcoming conference. October is Domestic Violence Awareness Month, and as part of our Family Justice Center efforts, we are hosting a conference just focusing on domestic violence. It is going to be hosted at the New Jersey Law Center in the Rutgers campus, October 24th and 25th. We have a very cool agenda. We have Rachel Snyder as a keynote speaker, of Rutgers, local professor, Dr. Vasquez. We have Dr. Cocchiola. We have a member of the National Network to End Domestic Violence. So if you click on the first link, you'll see the full agenda. It's a 2 full days. It is free. We are serving lunch. So I hope I can see some of you there. Again, this is a very big focus on domestic violence and the work that providers do. It is also open to survivors and anyone that just has an interest. We do have limited seats up to, I think, 150, 60 people. And we are currently at 122 today. So if you have an interest to join us, I would recommend that you try to register soon. And happy Domestic Violence Awareness Month. Next Thursday, the 17th, is Purple Thursday. Michael, I'll be sending you this information so you can blast it out to everyone here. I'm going to be wearing purple, and I invite you, since green was brought up for tomorrow, I'll share about purple for next Thursday. So thank you all for the work you do, and I hope to see you at the conference.
Thank you, Maria. And yeah, I will get that out as soon as I get it from you.
Okay, anybody else have any upcoming events or any updates that they'd like to share?
This is Lena. I don't know if you asked about books and barbershops. I always get skipped over.
I missed that.
Hi.
Please,
Hi,
go ahead.
Chris. So this is my plea for everybody to join the Books and Barbershops. This is a program that's been on the HASAC for about 5 years now. We have really grown. It's a 6-year program, and it highlights literacy, and it involves the community altogether from every level, from having the exact small business owners and barbershop owners and the community together, everything that we stand for. So this program, we have a big anniversary event, usually during Dr. Seuss Week, Read Across America, where it's been at the New Brunswick Elks. Last year, we've kind of turned this into a carnival. It started out with 20 people, and last year we had about 200 kids and adults alike. We have guest readers. We highlight the barbers that participate every year, and they certainly give out free haircuts and everything that we can, and it's a great event for the community alike. Everybody just shows up, and it's really a highlight and a great job for the barbers, and it's a great job for the people in the community. And last year we were able to invite childcare providers and all people that deal with kids. So in terms of fashion, in terms of daycares and everything in between, they had a booth that was set up, some children's authors. So my plea here is to ask anybody on this group to even show up at our events. We had a big crowd. The event is usually in March, and I'll make sure that I hand it to you guys early in advance. If you would like to be on the committee, we will have a meeting in about 10 days on October 19th, and I will send the Zoom link to Michael and he can get it out. Why is it beneficial for you to be on this group and participate? Because it holds you close to the community that we all serve. So some of those questions that you had, they could be easily answered because we have direct route from the community and knowing the emergent needs of the community, which was the reason why, we figured this would work. So I'm asking again, if you guys would love to be involved, I would definitely get it out to the schools, which really, really pour over. And it's a great event. So we always have tons of readers. We had Judge Revis read. We've had John Johnson from the Office of the Public Defenders. And prosecutor's office, and we've had a lot of big ticket people here. So I would love for you guys to become involved and not just hear me and actually participate. We would like to have you, you could donate to this program. You could send kids from your program. You can have, there's various ways you guys can be involved. So here's my plea. If you'd like more information, I will put our email in the chat. And if you would like to, just send us an email and we'll get you on the blast to make sure that you are on the Zoom. Okay, so that's Books and Barbershops.
Any questions for Lena?
Okay. Anybody else want to share what they have going on? I know, NRA, I know you just put your event into the chat as well.
Yes. So we are looking for vendors still for our trunk or treat. We have about I know it sounds a lot, so we do get help and donations. So our trunk or treat is gonna be October 25th at the Brunswick Middle School. We start from 5 to around 6:30. And we are asking vendors to bring 3 or 4 bags, but we will have extra candy that is donated to us. So if the vendors do run out, Ashley knows, I think she's been there, so we do give out candy. But we are still looking for vendors, so come out and promote your services. It's a free event for families. We give out 150 Halloween costumes, and we also do a food distribution for 175 families. So please feel free to register. If you have any questions, feel free to reach out to myself. Thank you.
2 seconds.
All right, thank you. Ashley.
Yes, good afternoon again, everybody. As a community alignment specialist, I have to host these educational sessions. So for October, I am hosting Healthy Relationships as a Foundation for Your Family. Elaine Hewins, who is the Hospital Violence Intervention Program manager from RWJ, will be presenting. The one for November is Unity Square, and December I am still working on. So I will send you the email, Rob. I know you get it all the time. And please just feel free to join. You don't have to be on camera. It's okay. And, join. Thank you so much.
Awesome, thank you. Anybody else? Any additional comments, questions, or concerns? Awesome. Michael, anything that you want to add?
I would just say that we did recently have our training on the services locator tool. I would like to say it went off without a hitch, but there were a couple of hitches. We did get it done though, and we do have a recording available. We're going to hold another one again in just a couple of months, but we did have roughly, I'd say about 90 people show up. So it does bode well for the tool. We are having some data come in from the Find Help group that shows that the tool is being used. It is increasing in use. There are some areas of improvement that I think we all as a community could maybe look into and try to work on. But any steps forward, I think, are positive steps, and we are making positive steps forward. If anybody is interested in, we have the PDF flyer that is in English on one side, Spanish on the other, or the info cards, same thing, English on one side, Spanish on the other. Both have QR codes that will take individuals to the tool. Definitely let me know. I can get those out to you as soon as possible. And if you are interested in maybe looking at the recording of the training or have somebody in your organization that would benefit from learning more about how to use the tool, let me know. I can get that link out to you as well. Other than that, I don't think I have anything else.
All right, fantastic. Well, then with that, I just want to make everybody aware that our next meeting is going to be on December 11th in person at Middlesex College. Michael will send out the information once all the logistics are finalized. But then I don't have anything. So with that, can I get a motion to adjourn? Bridget, thank you. A second. Lana, thank you. And all in favor? All right. All right. Thank you all so much, and have a great rest of your evening or day.
Thanks, everybody.
Thank
Have a
you.
good
Thank
one.
you.
Thank you.
Bye, everyone. Have a good
Take
rest of
care,
your day.
everyone.